I haven't looked at it much.
Jamaica, are you good with starting with week 3?
Yes,
Okay.
yes, ma'am. I'm good with that.
Okay. So we'll start with week 3. So that's your school age and your adolescence. So we'll start with school age first. I'll get this pulled up and then we'll go from there. Then we can go to week 2 maybe after, and then week 1. Just make sure you guys are using your PowerPoint. That serves as kind of like a study guide for you. So the exam review PowerPoint will help. If you're seeing things on there that you don't remember reading about, then you probably better go back and look at your book. Okay.
Okay.
Know your theorists and the developmental stages. That'll be really helpful. Okay.
Okay.
Okay. Let's see. This is this. Let me share my screen here. Alrighty, are you guys able to see that?
Yes.
Okay, perfect. I'll pull it up. Let me know if for some reason it's kind of, I know sometimes Kahoots isn't always the best for like loading and things. And then I can read the questions to you guys and the answers, or I can just let you guys read them yourselves, whichever you prefer. Perfect. All right. Do you guys want me to read you the questions and the answers, or do you want to read them and just pick?
That's
You can read the question. We can pick.
Okay. Perfect. Okay. So school age we'll start with. Okay. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning. Yes, they understand that they have good or bad actions and then they have consequences. Good. All right. In which of Erickson's stages do children begin to understand conservation? Also, this shouldn't be, it shouldn't say Erickson. This is wrong. It should say Piaget, because Piaget is the cognitive theorist. So conservation goes along with your cognitive theorist. That's when you guys might remember from week 1, we talked about the kids realizing that like a tall skinny cup, even if that's 8 ounces, and a short wider cup is also 8 ounces, they understand that both have the same amount of water in them. So that's your conservation. And that comes along with the concrete operations. And that's preschool age kids usually. Preschool, well, school age kids, excuse me. Okay. But this is Piaget's, not Erickson's. Erickson is like your identity versus role confusion, you know, like your psychosocial. This is your cognitive theorist. Okay. Good. Okay, now according to Erickson, industry versus inferiority begins at what age? Yes, good. School age, 6 to 12 months or years, excuse me, not months. So yeah, industry versus inferiority. They're getting really industrious. They should be. As long as their parents allow them to do things for themselves that they're capable of doing, then they feel that they're kind of mastering those skills. Okay. If they are not allowed to do that, like they have parents maybe that don't let them do things for themselves because it takes longer, then they feel inferior. And a lot of times they have problems with their self-esteem. Okay. So Erickson, that's your psychosocial. Good. Okay, multiple select. Erickson, industry versus inferiority. School, oh, I'll let you guys read the answers. Good. Yep. So the school age kids is this category for industry versus inferiority. They're becoming competent or mastering their skills. Okay. They're confident in their own abilities and they are happy when they accomplish them. Okay. Good. Okay. Which is a common sign of stress in school age children? Yep. Stomach pains, vague stomach pains. They just say my stomach hurts. What does that kind of lead you to wonder what's going on with them if they're just complaining of stomach aches often?
it could be at being that it's school age. It could be that they're having problems in school, they're being bullied, or even um, they're not doing well in school and they feel embarrassed or not really going well. So they just don't want to go. They really don't really want to go to school. So they're complaining about they're sick so that they don't have to go to school.
Yep. Or like maybe a little nervous, right? A little nervous about
Yeah.
something. Mm-hmm. Yeah. Good. The other common thing now, it's not a sign of stress per se, but stomach complaints in school age kids, a lot of times it's constipation driven. So, okay. They're not eating the healthiest, so they tend to be constipated. Good. All right, multiple select. What are signs of stress in school age children that need to be investigated? Good. Yes. Regression to an earlier behavior in bedwetting. What would you guys be concerned about if you had a kiddo who was school age that was having behavior regressions and bedwetting?
I know I was told not to relate this a lot, but I seen in psych in behavior clinic when the child was being assaulted at home
Mm-hmm.
or at school, they can be go backwards to this.
Uh-huh. And have bedwetting problems. Mm-hmm.
Yeah.
Yep. Yep. That would be your number one concern. Some sort of abuse. Usually more sexual abuse when the bedwetting's involved too, but it can be any form of abuse that causes behavioral regressions. And bedwetting can be included in that. But yes, good. Okay, multiple select. Safety education for school age child might include yes, all of those, okay? So your motor vehicle safety in school age kids is probably more related to them being a pedestrian and like looking both ways before they cross the street and making sure that they wear their seatbelt or they're in a car seat that they need to be in or a booster seat. Okay. Firearm safety, kids, there's a lot of firearm deaths or accidents with firearms that aren't safely stored. So making sure that they understand, and parents included in that, that firearms are, if they're going to have them in the home, that the kiddo cannot get to them. Okay. And then that kiddo should be taught, obviously not to access those if they somehow figure that out. Okay. Bicycle safety, water safety. So all of those topics are things that should be included in school age education for safety. Okay. Good. Okay. Dental care typically begins around what age? This question's a little out of place. Yep, good. 1 year of age. Okay. According to Erickson, trust is to blank as identity is to blank. Yes, good. Trust is to infancy. Remember, that's trust versus mistrust for Erickson, and identity versus role confusion for adolescents. Okay, good. How does the onset of pubertal growth spurt compare in girls and boys? Yes, girls are earlier than boys. Okay. What age appropriate activities should be included in teaching for a 6-year-old child? Yes, good. Jump roping. Okay, how is chickenpox spread? Airborne. Okay, chickenpox and measles, both, they're really contagious, super duper contagious. So they're airborne spread. You can go into a room up to 2 to 3 hours after someone with chickenpox or measles has been in there. And if you don't have immunity, then it's almost like 90% that you'll likely get infected. Okay, so really, really contagious. Okay, and spread via airborne. So they have to be in the negative pressure room, and you have to have the N95 mask or the PAPR. With chickenpox, if their lesions are oozing and things, a lot of times you do contact precautions, with your N95 mask. Okay. Okay, another multiple select. At what point is the child with chickenpox not considered contagious? Yep, good. No new eruptions, lesions crusted over, and no fever for 24 hours. If you wait until no itching, that's going to take like forever. Because as those lesions are healing, they're still pretty itchy. Okay, good. Which age group characteristically plays with same-sex peers? Yep, good. 6 to 12-year-olds. Those school age kids. Culturally competent care includes what? Good. Yep, incorporating that patient's cultural beliefs to their plan of care. Good. True or false? Flossing daily is recommended for good dental health. Yes, good. False. Or true. Excuse me. Six-year-old needs a chest x-ray. What explanation is best? Yes, good. Using a large camera to take a picture to look inside your body. Good. Care for a knocked out tooth. What do you do if a kiddo loses their tooth? Yep, put it in milk or saline and get it to the dentist. Ideally, cool milk or cooler saline. Okay. Good. What thought process involves logical thinking for the school age child based on the developmental theorist? Concrete operations, logical thinking. So that's that Piaget, right? Your cognitive theorist. So concrete operations. That's where conservatism is. Okay. Erickson school age, select all that apply. Yep, all of those are included, okay? So Erickson stage for school age kids, 6 to 12 is industry versus inferiority. They should be allowed to accomplish tasks and should be challenged with tasks, okay? And then also taught that not everyone will master every skill. Good. All right, according to Kohlberg, conventional morality, school age children believe what? Following the rules is the right thing to do. School age kids are typically rule followers, okay? Okay? But they understand right, wrong and right. So I understand why you picked the other one too. Good. Anorexia nervosa. What is anorexia nervosa? Yep, good. Eating disorder where they're in starvation. Which signs may indicate that someone is struggling with bulimia? These questions should be in the adolescent. Yes, all of the above. So sore throat that's not going away because they're vomiting often, right? And their throat's irritated. Teeth problems because of the stomach acid that they keep in the bile that they keep throwing up. Starts to decay your teeth and cause sensitivities. And then frequent trips to the bathroom after eating because they're purging. Okay. Good. Which of the following could be a sign of potential child abuse or neglect? Yes, good. Unexplained injuries or bruises. Or kids kind of telling you multiple different stories, or not wanting to really talk to you about what happened. That sometimes is also concerning. Good. Cooperative play. What is cooperative play? Good. Yep. Kids working together to reach a common goal. Okay. So they're playing a game and they all want to win and they all have the same goal in mind. Okay. Now, associative play for the younger kids, like preschool to early childhood. Remember what associative play is? We're playing together the same thing, but we don't all want to do the same. So, like, we're building with Legos, but we don't all want to build the exact same castle or house or whatever. Okay. So that's your associative play. Where cooperative play is we're playing the same thing all together and we have the same goal in mind. Good. What type of play is considered cooperative play? Yep, good. Playing checkers. Okay, last question from this one. What two common signs and symptoms can be found in children that have ADHD? Yes, interrupting and lack of focus. And you're going to start to see that in the school age kids. Okay, early school age. Usually, most people don't like to diagnose it until about 6 because they have to have symptoms in 2 separate settings. So, like in the home setting and the school setting, and it has to cause problems for them. So, like if kids are kind of hyperactive and have trouble focusing, but teachers and people can redirect them and they can do their schoolwork and have friends and all of that, then you don't have to worry about them needing medication usually. But if they're struggling socially or they're struggling with their schoolwork and behind, then that's usually when you look at them needing medications. Okay. Good. All right. Let's stop my share screen here really quick and then we'll go to. Do you guys want to go to adolescence? So that's week 3 as well, or do you want to go somewhere else?
We can go to adolescence.
Okay.
That's the one I struggle with.
Yeah. Yeah, adolescents are kind of tough to manage, that's for sure. Let's see, sorry, it's loading forever.
You said the one we just did is lecture like for this week.
Yeah, for this week. Yep. And same with adolescents as well. And this week you guys will have a quiz over your week 2 stuff. So infants and toddler preschool. But yes, this is for this week. So
Besides just memorizing it, is there a way, like I struggle the most with the levels. Like if you were just to say
there is.
mistrust, infant, like, but I guess putting it into like clinical questions.
Yeah. So on this exam, you're going to need to know like age ranges and where they fall and the names of the theorist and the stages that the kiddos fall in. Now there's probably also going to be some questions, or usually are some questions that include like kind of needing to know that at a baseline, and then how you would apply their developmental stage to that question, but not necessarily need to know just like the trust versus mistrust as the answer. Does that make sense?
Yeah.
Uh-huh. Now going forward, so like your guys' exams, and I know my class, I told them this, I assume other providers or professors have told their students this as well, but like your exams aren't comprehensive. So it's week 1 to 3 material. That's your first exam. That material going forward, what you'll need to know is like the developmental stages and things like that. But to be asked like, okay, it's a school age kid, it's an 8-year-old, what stage of Erickson are they in? You won't be asked questions like that typically after this week exam. But you'll kind of need to know, okay, this kid should be, doing things themselves, or if it's a baby and they're crying all the time and they're not getting those needs met, then they're going to be in mistrust. So they're going to be more of a finicky kind of personality kiddo as they get older. Does that make sense?
Mm-hmm.
And kind of then how you would apply that to your questions.
Okay.
Going forward. Now, like I said, some of that's going to be on this exam too. But yeah, you definitely, I mean, I wish that there was a better way for me to tell you to just memorize the theorist. But as you go forward, like if you go on for your BSN or your master's or your doctorate, like theory and all the theorists are things that you're going to have to know the whole time, and you're just going to have to memorize them, unfortunately.
Okay.
Okay. I know it's a lot. And all the developmental stages, like knowing those, that will be really helpful too. I know my class, they got a handout that kind of broke down theorists and developmental stages, like milestones. So if you haven't received that, you can ask your professor.
She gave that the first week, I think.
Okay. Yep. Yeah. That's usually when I have it, is in the first week announcements. And then if you're looking and you can't find it, I can send it to you guys too.
Okay.
But yeah, I wish that there was a better way for me to tell you, because rote memorization isn't really a great way for any of us to study. But unfortunately, with the theorist and the milestones, that's kind of the only thing that I can suggest that you do, is just go through them like on flashcards or something. Okay.
Okay.
Do your Kahoots. Those will be helpful. Like I said, use your PowerPoint as a study guide, essentially. As you're flipping through it, if you see something and you're like, crap, I don't remember reading about that, or I don't remember talking about that in class, go back to your book and read about it.
Okay.
Okay. So we don't give out like listed study guides, but the PowerPoints are kind of service study guides, essentially. Okay. What other questions? Do you guys have any other questions before we start this week?
I'm good.
Okay. All right, let me share my screen again here. Okay. There. I think you guys should be able to see that now. I'll just read the questions again like I did last time. All right, let's get going here. Okay, adolescence. Erickson's identity versus role confusion. Which stage? Yep, good. Adolescence, okay? So they're trying to figure out where they fit in, what they're going to do with their life, pushing boundaries, okay? Experimenting, okay? And then if they're not able to do those things, like they have really extremely restrictive parents, and they're not allowed to do much of anything, then they're going to have, a lot of role confusion and identity confusion. Okay. And Erickson is your psychosocial. So think about like social kind of things go along with psychosocial versus your cognitive, where it's more logical kind of things that go along with that, or thinking. Okay. This is when adolescents need to establish their own identity to form values to live by. Yes, good. Stage 5 of Erickson's. Identity versus role confusion. Okay, good. Identity versus role confusion stage in adolescence. Yes, searching for a sense of self and personal identity. Good. What age do you have to be to drive an ATV? This is like legally, technically. Yep, 16. No kids under 16 should drive four-wheelers or ATVs or UTVs, whatever you want to call them. Okay. And after age 16 or starting at age 16, they should still wear a helmet and things like that while they're on them. Okay. Now, I know plenty of people let their kids drive those before.
Yes, that's me. I let my daughters, we go mudding.
Yep. Just make sure they're in helmets because you only have one brain.
So I guess I'm the bad parent.
Oh, no. I understand. I have a 9-year-old and she rides on one mostly with my husband, but sometimes I see her putting around on it. I'm not thrilled about it, but I understand. But helmets. I get the biggest eye roll about that, but it's important. Okay, since surviving a sexual assault, she startles easily, feels numb, emotionally, has flashbacks. Her symptoms resemble what? Yep, post-traumatic stress disorder. Okay, good. After a trauma like that, and then you start to have, kind of anxious feelings. Usually PTSD is what's diagnosed. So it can be with sexual assault, it can be with a physical assault, it could be, you witnessed an act of violence, and that can be a diagnosis for PTSD as well. Many victims experience emotional and blank reactions from rape or sexual assault. Emotional and psychological. I would say physical. I mean, you could argue that. I would say physical reactions, stomach pains, vague headaches, like somatic kind of symptoms. Yeah, I would agree with that. So I could see how either one of those answers could be involved there. Good. Which of the following are false about the HPV vaccine series? I feel like that's incorrect. So the vaccine series is either 2 or 3 injections. It depends on when you start it. Okay. That started before 15, which is correct. So like this adolescents less than 15 only need 2 shots. That's correct. For the kids who are getting 2 shots, the interval has to be at least 6 months. Okay. So I would pick this one. An additional doses needed. No, because that's correct too. So if they get their say you have a 14-year-old. They haven't started their HPV vaccine, but they come to their well check and they want to start that. The parents want to start it today. They're 14, so they're starting before they're 15, so they only need 2 doses. Okay. They have to be at least 6 months apart. If one is given earlier than 6 months, then you have to redo it. Okay. So this additional dose is needed if only 5 months between shots. That's accurate. Now, if you have a 15-year-old, they've never gotten the HPV vaccine ever, not 1 dose, and they decide they want to get it, they have to have 3 doses. Because the reasoning is because it's pretty likely in our culture today that most 15-year-olds have already been exposed sexually to HPV. Okay. So that's why they get an extra dose. So I don't really like this question, I guess is what I'm trying to say, because it does depend on maybe 2 doses or 3 doses for the HPV vaccine. And this can start at age 9 earliest. Most providers, like in my clinic, we start at age 11. And the ideal is you start it before there's any potential sexual exposure, because then you're a lot more, you get a lot more benefit of preventing HPV and the cancers that go along with HPV.
I
Okay.
think that confused me a lot because again, going back to work, a child was sexual assaulted and she was less than 15 and she had to have 3 in injections. So I'm like, less than 15 only needs 2. Sometimes they need more, because that, I think, the only threw me off.
Right.
Yeah.
Yeah. Yep. If there's been an exposure, then there is some literature that says you could do 3 doses. But pretty much across the board, it's if they're less than 15, 2 doses.
Okay.
Yeah. Okay. But yeah, the reasoning behind that age 15, if it started after that, it's just because likely that they've already been exposed potentially. Okay. And then even if they're 15 and they haven't had intercourse or an assault or anything like that, then they still get 3. Okay. Good. Okay. At what age should a parent expect to have major conflicts over independence and control with their child? Yep. Good. 15 to 17. They're starting to drive. They're wanting to hang out with their friends more than their family. They're becoming kind of more independent in that age range. So a lot more struggles. What Tanner stage marks onset of puberty in most males? Oh, sorry. Okay, stage 2. Sorry. I clicked next. So the scrotum and the testes are enlarged. Scrotal skin has texture changes, so it gets that kind of rugae, like so the wrinkles, and then also more of a red appearance. Okay, to the scrotum. So that's the first kind of change in puberty. Okay. Good. What marks the onset of puberty in girls? Yep, menarche. To the start of their period, their menstrual cycles. Good. You could also argue like phalarche, which is where they get their breast buds. Okay. That's kind of the start of the process. Most kids or girls, after they get their breastfeds, within 2 years, they should have their period. If they're going longer than 2 years, then that's concerning and they probably need to see an endocrinologist about it. Have some hormone tests and things checked. Okay. Good. What is the Tanner scale used for? Yep, measuring puberty and sexual maturation, right? Good. Come on. Major causes of death and injury in adolescence include yep, vehicle accidents. Whether they're driving, they're riding with a friend, they're getting hit by a car. Motor vehicle accidents is the most common injury for adolescents as well. Okay. Same with children. Good. True or false? Sex education for adolescents aims to provide information to the adolescents about issues related to sex. True. Yep, good. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? Yep, have the parents leave the room. Now, some parents get really upset about this. So at times it's really kind of an awkward conversation to have, but usually starting at age 12, I just start to ask all kids, okay, or tell all kids, okay, we're going to have your parents step out at one point so we can talk, confidentially between ourselves. Some parents and some kids will say, no, I don't want to do that. So obviously you can't force them to leave the room, correct? But it's something that I usually just say, we're starting to make more adult choices. We're getting older. So I usually have parents step out. And most of the time, parents are pretty receptive to that. Most of the time. Okay.
Not me. I tell you, you be shaming me. You be shaming me. Last week, the
You're
doctor
fine.
asked me to leave the room for my daughters. Because one of them just turned 13, the other turned 12. They said, "Can you leave the room?" I said, "No, not in this history."
Yep. Yeah. Yeah. So, the reasoning behind that is just to get them kind of used to being able to talk to their provider alone and ask questions if they want. So, like I said, I can't force people to leave the room, but usually if the kiddo wants parents to leave the room, then I'm a little bit more likely to kind of enforce that. But and the reasoning behind that is because sometimes kids will say, that they're in an unsafe environment or something like that. So that's another piece of it. Or they were assaulted sexually at school or by a peer or something, and the parents have no idea, and they have shame and they're afraid that they're going to get in trouble if they, tell anybody about it. So that's kind of the other piece of it too. So I understand as a parent, you're kind of like, no, but
She's 12. No.
Yeah. But unfortunately, in this day and age, some things are, everything's happening earlier for these kiddos, unfortunately. So
Yes, ma'am.
that's usually why it starts around age 12. So,
Okay.
but yeah, that's pretty important. But I understand as a parent, it kind of makes you say they're 12. Do we really have to do that yet? But it's pretty important. Okay, true or false? Keeping a food diary is the first step in the treatment for an obese child. true, actually. Okay. So you don't want them to be like logging calories, okay, and looking at it in that way, but just to help the kiddo realize, okay, I'm eating this. It kind of helps you as the provider or the nurse to be able to talk with that child and the parent kind of about their intake and how that might be affecting their weight. Okay. So we're not like doing super restrictive calorie counts or anything like that, dietary wise, usually for kids. Now, there are some special cases where they see like a weight loss clinic because they're morbidly obese, that, you know, they may be more on calorie restrictions, but in general, the first step, and this goes along with like, if you have a kiddo that's having like headaches or stomach aches, having them keep a food journal can be helpful for that too, because a lot of times you can kind of correlate a food or something that they're eating, to kind of cause some of their symptoms too. Okay. Now, in a kiddo who has an eating disorder, having them keep a food log, that's not always a recommendation, because a lot of times it kind of makes them hyper focus more on starvation or purging, either one. Okay. So if you're suspicious of something like that, having them keep a food log is probably not overly beneficial. Okay, last question, a multiple select. An adolescent has been brought into the ER for a drug overdose. What are your initial questions to ask? Yep, good. When did you take it? What did you take? How did you take it? Those are your initial questions. Good. Good. Alrighty, we're all done with that one. We have about, goodness, 7 minutes left. You guys want to do week 2? Do you want to do toddler, preschool, or infants?
Either's good with me.
Yeah,
Either one. Okay.
one.
Let's do toddler, preschool. Or let's do, hang on. Let's do infants. They have the milestones and things in there, so. And you guys should have all these Kahoots and everything under your week 1 exam reviews, or excuse me, exam review 1 announcements. Okay. Share my screen here while it's loading. Okay. 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 Week 2 infants. So this is stuff that could be on your quiz today too. In general, or well, this week, I guess I should say. In general, infants should triple their birth weight at blank months of age. 12 months. Yep, good. An infant's weight should blank by 6 months. Double. Yep, Multiple select. Infant nutrition includes what? Good. No honey and no cow's milk until they're a year. Okay. Good. Another multiple select. Infant nutrition for the first 6 months. Breast milk or formula. That's iron fortified. Okay. Good. Multiple select. Nutrition interventions for an infant include. Yes. So vitamin D if they're only on breast milk because they're not getting vitamin D through breast milk. Okay. If they're on formula, they don't need extra vitamin D because it's in the formula. Okay. Like I already said, formula has to be iron fortified and one solid food. So when they start foods after 6 months or at 6 months, one solid food at a time, and then wait 4 to 7 days before you add. Now, I will tell you, this is an older recommendation. They've gone away from this, but for your test purposes and your book purposes and your exams and HESIs, one solid food at a time. Okay. But an 8-month-old infant should be expected to perform which fine motor skill? Yep. Hold on to a rattle with their handle. Okay. And then a crude pincer grasp. Do you guys remember what the crude pincer grasp is?
Like a knee grab, like putting the object in their fingers.
So this is the fine pincer grasp.
Oh, okay.
Pointer finger and thumb. Okay. That comes a little later, like by 10 months. Okay. The crude pincer grasp is like they're using more than just their pointer and thumb finger to grab things. Okay. So that one comes earlier. Okay. Good. Okay. Which of the following is an example of fine motor skills in infants? Yep, good. Fine motor skills are your fine movements. Fingers, fine. Think of that, okay? There's other fine motor movements, but most of them happen with your fingers. Okay? Gross motor movements are your big, full body movements. Okay? So, like walking, jumping, crawling, all of that's gross motor. Good. Which is the correct order for development of gross motor skills in infants? Yep, holds their head up, roll over. Okay. Steady with sitting. Like when you're holding them up, they can hold their head steady when they're sitting. Okay. And then standing with help and then standing alone. That's the ideal kind of flow. Okay. Not every kiddo goes that exact stepwise approach, but that's the ideal way. We'll do one more since we started a little late. Okay, at what age can an infant typically sit unsupported? Yes, good. 8 months. You guys were quick on that, so we'll do one more. At what age does an infant typically start rolling over? 5 months. How do they roll first? Which way?
From, I think it's from their tummy to their back.
Yes. And then back to belly after.
Yeah.
Yep. Good. An infant's head circumference is bigger at birth than later in life, right? Their head's kind of the biggest part of their body till they get to toddlerhood. Then it's kind of their belly and their head. Okay. And then their belly starts to get bigger. Okay. Good. Any other questions that you guys have?
No, ma'am.
Okay. Thank you for joining me this morning. I know it was kind of early, but reach out to me if you need anything. Okay. You can reach out to
Okay.
your professors too. And then good luck on quizzes this week and good luck on your first exam. Try not to get discouraged. A lot of times the first exam is a lot. Okay.
Yes.
So try not to get discouraged after it. Study
Okay.
hard and you'll know you're prepared.
Yeah.
Okay.
Okay. Thank you so much.
And other live reviews, that's helpful, but definitely going to a live review is a lot more beneficial to you than not.
Yeah.
Okay.
Thank you.
Yep. See you
Thank
guys
you.
later.
Bye.
Thank you
Bye.
for your time.
Yep.